down all things COVID-19. Dr. Charles Bruce-Tagoe, the Fairfield Regional Medical Director at Hartford Healthcare, St. Vincent's. Good to see you again. Thanks for joining us.
Thanks for having me.
Okay, so we've heard about the importance of masking in schools and other settings to reduce the spread of COVID-19. The mandates are here to stay, at least for now, it appears, but will they change if vaccine for younger children is approved, like some of our viewers mentioned there? We know the FDA is meeting later this month to discuss those shots for 5 to 11-year-olds. So, Doctor, what happens next?
I believe the mandate might change once enough kids are vaccinated. If we get a good rate of vaccination, maybe 75 to 80%, that will help to get the mandate dropped and the mask could come off. Obviously, we'll have to be wary of either variants that may crop up and that may make the vaccines not as effective. But hopefully, if we're judging from what we've learned historically so far, the vaccines seem to have been holding up, and hopefully that should be the same for the children once the vaccines are mandated for them, if the approval goes through.
Yeah, let's certainly hope that that's the case, Doctor. Absolutely. Another new important development today we want to ask you about, a possible new antibody treatment moving forward. AstraZeneca has filed for an emergency use authorization for a treatment that it says presents symptomatic COVID-19, especially in those who didn't get a response from vaccination. The data claims the antibody treatment is 77% effective. More data is expected later this year. But, Doctor, how big of a development is this? And does it replace the need for vaccines? You got many people who say, well, wait a minute, I don't want the shot, but maybe I'll consider this.
So I think it's going to be a great game changer. We do know no vaccine is 100% effective. So if you do take the shot, especially for those of us who have very weak immune systems and could not respond appropriately or as expected to the current vaccines we have from J&J, Pfizer, and Moderna, this could actually be a big help. For those who are considering, hey, why take the vaccine when I could take this? Well, it's similar to the vaccine. So if you're willing to take this, you might as well take the vaccine if you're eligible and if you meet the criteria. So I would say for those who have the ability to mount an appropriate immune response, take one of the 3 that are available currently. And for those mount an immune response as appropriate as expected, then yes, the AstraZeneca is the savior for them.
All right, very good. Well, Doctor, let's talk about what happens right now. If you think you have COVID-19 and you want to get tested, the FDA this week greenlighting an over-the-counter antigen test from Acon Labs on an emergency basis. It's called FlowFlex. Doctor, how important are tests like these in helping to stop the spread of COVID-19? And more importantly, I guess, are they accurate?
Very good question. I haven't seen the numbers yet on the accuracy of the new test from Acon, but we do know that if you are infected with COVID, you want to stay away from people, so self-isolate, take all the necessary precautions, and if you feel very sick, seek treatment in the hospital. Now, if you have access to a rapid test that you could do at home, self-test, you get into 15 minutes, that gives you a chance, and it gives you a heads up, and it puts you so that if you feel a little under the weather, you step over to your local pharmaceutical shop, buy your test, go home, test yourself, and you know right away what to do. The current ones that are available are about 50-50 for the rapid. So if it's negative or symptoms, you know you're more than likely not infected. But if it's negative, it's likely a false negative, so you go get the PCR testing for it. So if this test from Acon sort of comes close to, it's a good tool to have in another tool to have in our set of tools in our toolbox to give us a fighting chance against this infection.
Doctor, real quickly before you go, I want to ask you about an offshoot issue, blood donations. We're hearing there's a big drop in blood donations. The Red Cross says right now it has less than a day's supply of certain blood types. Take a listen. Well, maybe we don't have that soundbite, but Doctor, quickly, your reaction to hearing that.
So there's been an increase, I think about a 12% increase in demand for blood from the Red Cross this last year. And that's led to about a 10% drop in blood available and blood products available for patients who might need them in hospitals and other health facilities. So this puts a on the situation.
Right.
So patients are in need of blood. There's been a shortage, and therefore life-saving donations are badly needed.
All right.
So yeah, with this.
I'm going to jump in here just because we have to hit a break, but Dr. Charles Bruce-Tagoe, appreciate your insight as always. Thank you so much for joining us. This is The New Normal. We'll be right back.